Hello, my name is Gabrielle Durand, and welcome to my presentation on differentiated instruction strategies in applied behavioral analysis. In this workshop, I will be introducing differentiated instruction strategies that I have used or plan to use soon in the field of ABA. I will also be sharing what I have learned regarding these strategies by sharing personal experiences and providing examples of how I intend to use other strategies that I have yet to implement in the clinical setting. To start off this workshop, I will now introduce you to a bit of my background. My current educational context is working in the field of applied behavior analysis, which is also known as ABA, as a lead registered behavior technician and clinical trainer. In regard to my level of expertise with differentiated instruction, I would have to express that I am an expert. The reasoning behind my determination as an expert is due to being in the educational field for almost 10 years. I have started from babysitting and then moved to the classroom setting by taking hands-on childcare classes in high school. During high school, I began working in daycares up until February of 2023. I have used differentiated instruction in all of these settings, including my current setting now, which is ABA. When working in the daycare settings, I have worked with all ages from infant to school ages. Being able to implement differentiated instruction strategies because not all my students have had the same learning styles, and I would have to adjust my lesson plans accordingly to accommodate all my students. In ABA, certain clients need certain stimuli and instruction to engage in successful sessions to help with behavior reduction. Some of the clients needed program modifications due to needing to be more challenged. Now we'll be going into the topic we are going to be exploring, which is differentiated instruction strategies in applied behavioral analysis. The reason I chose to explore this topic is simply because as a lead RBT and have been supervising many other therapists that are just now entering the field, this workshop can be deemed as informational and beneficial for their implementation skills in sessions with their clients. I also chose this topic because I also believe I can learn and utilize the tools given in this workshop. I also want to gain new ways to implement differentiated instruction strategies in sessions. During the learning process, I was able to gain knowledge on strategies that can be used in the clinical setting with ABA as well as a classroom setting. The first strategy I took note of was scaffold instruction. While some students might not be able to work independently, others might require assistance from the teacher or their peers. Students are able to work at their level thanks to our tiered support system. It might be difficult for a classroom instructor to address every requirement of each individual student, so enlisting the aid of paraprofessionals, more experienced classmates, or parent volunteers can be beneficial. The second strategy that I have found to be useful is using manipulative and graphic organizers. A large number of special needs students can also think concretely. As a result, they might need tangible answers to encourage them to participate in the current work. A wonderful tool for keeping children engaged, focused, and on track as a graphic organizer. Kids find great use for visual organizers when they are writing. In addition to keeping students organized, teachers can employ visual organizers and manipulatives to differentiate the work-through process. The majority of pre-K through 5 teachers have already abandoned the strict alphabetical rows in which students are supposed to complete the same assignment in the same manner. Rather, teachers increasingly base their lesson planning and delivery on the individual characteristics among their students. The same ideals must permeate the teaching setting. As a result, it is imperative that schools create spaces where students can collaborate with their peers, but these spaces couldn't only serve as locations for social events. For students with exceptional needs, routines are crucial. Whatever setup you choose is most effective for your class. Make sure to establish explicit expectations for both group and individual work. Clear expectations must be established and upheld in the classroom, and procedures must be followed when anything or someone goes off track. This is a difficult process that calls for expert classroom management skills. As we go into the products to help support my learning journey, we have a graphic organizer to help maintain a routine schedule in Figure 1, visual schedule pecs for the routine schedule in Figure 1.1, visual cue cards in Figure 2, an example of a collaborative workplace for clients in Figure 3, and an example of an individualized treatment room for clients in Figure 4. Using graphic organizers, tables, and charts to transform numbers and data into visual representations is known as scaffolding using graphic supports. Teachers can effectively convey highly abstract concepts or illustrate the relationships between elements in a phenomenon by using graphic scaffolds. Graphic supports should be handled like text because they are text with images. When elucidating charts, graphs, tables, and timelines, teachers must model careful reading skills because students typically require repeated reads to completely understand the concepts presented in the graph. When we discuss the factors of maintaining routines in ABA therapy, it is important to keep consistency during sessions. It keeps things in perspective. Even more crucial is a consistent schedule for kids on the autistic spectrum. A regular schedule can provide structure and predictability. It can help them feel more stable and give them more attention to their studies and social interactions. The process of getting autistic children ready for school may be life-changing, and ABA therapy is a vital component of making sure they are ready for the classroom. The goals of the scientifically proven ABA technique are to reduce problematic behaviors, increase independence, and teach adaptive skills. Being prepared for school involves more than just following the rules in the classroom. It also involves interacting with classmates and taking part in educational activities. ABA gives kids the skills they need to deal with these obstacles successfully. ABA promotes learning in a controlled and encouraging atmosphere by dissecting difficult tasks into manageable steps, progressively increasing children's competence and confidence. In Figure 4, having individual therapy rooms for each client is an added benefit to the clinical setting to help minimize any unnecessary distractions to help support clients in having successful treatment. After evaluating and self-reflecting on my learning experience for this project, the only thing I would do differently is to find visuals that work for each individual client and continue ensuring that other behavior technicians are following up-to-date protocols to ensure there is no harm done and working to support the best interests of their clients. After this self-selected project, it did help me grow as far as my knowledge in differentiated instruction. I have learned that differentiated instruction is universal and can be used in different settings, including clinical settings, not just the classroom. I also learned that with differentiated instruction, educators can consider the preferences of their students when developing curriculum and even give them the chance to take a more active role in their education. And these are just my references of the work that I provided during this workshop.